Hi, this is State Senator Tony Hwang, the ranking member on the Insurance and Real Estate Committee. Thank you so much for joining us today. I have with me Mr. Wyatt Bosworth, who is the Assistant General Counsel for the Connecticut Business and Industry Association, a organization that represents thousands of small, mid-sized, and large businesses employing hundreds of thousands of employees in the state of Connecticut. We are here to talk about a better way in regards to health insurance cost containment. I want to begin that it is quite clear that Republicans and Democrats all agree that the cost of healthcare insurance must be contained, managed, and made affordable. The process difference is how we go about it. You have a current proposal by the controller, Kevin Lembo, and the Democratic majority that is utilizing Senate Bill 842, which is creating a state-managed program called a partnership program that is an interesting perspective, and it really emphasizes the approach that it's state-controlled, managed healthcare versus the solutions that Governor Lamont has proposed in House Bill 6447 and the Republican of 1,000. I don't know how Bill got so big, but it's Senate Bill 1006. We wanted to be able to have business groups like CBIA that manage and represent the bulk of the utilization of health insurance to offer their thoughts and comments on the various components of the governor's proposal and the similar comparison to Senate Bill 1006. So Wyatt, welcome. Thank you so much for being here. The four major elements that we talked about, and we're in the midst of a public hearing on the governor's bill, are four areas of cost containment that is significantly different than a state takeover. The first area of cost containment is reinsurance. If you could explain to our public what reinsurance means and the 1332 exchange and the utilization of assessments or potential federal funds to be able to supplement and manage cost on that.
Sure. Thank you, Senator, and thank you for having CBIA present for today. We're really excited about Senate Bill 1006. We really see it as a viable alternative to a lot of the dangerous proposals coming out of the public option bill and the governor's assessment bill that your committee's hearing today. Essentially, reinsurance is insurance for insurers, right? So, the purpose of a reinsurance program would be to have startup funds, okay? So we would essentially create a pool. Your bill grabs those funds from the state budget. The governor's plan grabs those funds from an assessment levied on health plans. And the money that is captured would essentially cover high cost claims, catastrophic claims that really destabilize and increase premiums in the individual small and large group markets. So when we talk about pass-through funding, what we're saying is if we're able to insure those high catastrophic claims and premiums were to reduce as a result, the federal government would subsidize that reinsurance pool based off the percentage of premium tax credits that individuals are saving as a result of the reinsurance pool. So it's really the best bang for our buck when it comes to leveraging federal dollars to help lower the price of premiums in the individual and small group markets.
And what about the idea of what we hear so much of, the increase in infusion of federal funds during this COVID pandemic? Is it not an opportunity for us to leverage federal funding and Medicare funding to be able to utilize a reinsurance product without assessment or the tax on premium of policies? Because ultimately, those kind of costs get transferred to businesses.
Absolutely. And I think you raise a really good point. Sure, we could raise the money for a reinsurance program from an assessment. We could have Every insured individual contribute to that reinsurance fund. But unfortunately, a lot of, the benefit of the premium reductions that would come as a result of that, would be in conflict with the amount that they're paying towards the reinsurance pool. So if we can utilize state funds to start up this reinsurance pool, we could really get the maximum premium reduction available, and also the maximum federal reimbursement as well.
And this is insight from business entities that you are representing, that are paying, interacting, and living the life of paying insurance products and premiums. So you're getting that directly from those affected entities, which sometimes us in government don't always interact with. So I cannot say how much I appreciate you educating people about reinsurance and the idea of it. Can you talk a little bit more about the Wakely report that has been often cited?
Yeah, so I believe there's been two reports, one in 2018 and one in 2019. The Wakely report was commissioned by the state to essentially study the effects of a reinsurance pool in Connecticut. So, for example, the bill before your committee that your caucus has raised, the $20.2 million that it would borrow from the state budget, the Wakely report indicates that $20.2 million allocation would result in a 5% premium reduction in the individual marketplace. That's a lot of money for people, especially when we're seeing 3, 4, 5, 6% increases year after year. The Wakely report also tells us that, and this was confirmed by the governor's office at earlier today's hearing, that the federal government will essentially match dollar for dollar the amount of money that the state puts up to fund such a reinsurance pool. And that's really important because we need to get creative with the way we begin solving the healthcare crisis in the state of Connecticut. And reinsurance leverages federal dollars, it reduces premiums, and it creates a sustainable pool moving forward that can really bring much needed relief to the residents of Connecticut.
And the Wakely report, as you said, is a report commissioned by the state of Connecticut. And it is an entity that is objective, well, and internationally recognized for their objectivity and analysis. It's a validation and an affirmation of data points that we can use in making policy.
Oh, absolutely. And that's so important for any healthcare reform measure we take up in the state. From getting accurate numbers from the partnership plan, if public option is really going to be the vehicle moving forward, to getting accurate reimbursement details and dollar amounts to premium reduction when it comes to reinsurance programs. The Wakely report has been deemed credible by both folks on your side of the aisle and folks on the other side of the aisle. And it's
and
a
the
good
governor's office.
And the governor's office, correct. It's a good roadmap moving forward. And your bill essentially takes that $20.2 million and puts it as part of the reinsurance bill. And then that's a good first step to getting a 5% premium reduction for individuals in the marketplace.
It saves money, but at the same time does not impose an assessment or a tax on premium, which will ultimately be passed on to businesses and consumers. The second major component that we looked at in Senate Bill 1006 is benchmarking. We use benchmarking in our everyday kind of comparison shopping, but really there's many efforts in the past to utilize benchmarking for healthcare services to be able to manage and contain cost. Many entities, many states have tried it. Now, Massachusetts, our neighbor, had implemented a benchmarking system. They had a bit of a learning curve. Now, could you share a little bit what benchmarking means from a standpoint of health insurance cost containment provisions, but also how we can learn from Massachusetts and utilize those kind of lessons to make a better cost containment program as reflected in Senate Bill 1006 that can help us move forward in saving money?
Yeah, I mean, benchmarking, I mean, the state, the governor last year issued an executive order number 5 that essentially allowed or authorized the Office of Health Strategy to begin developing a cost growth benchmark for the state of Connecticut. Now, what is a benchmark? Essentially, what Massachusetts did, and I will summarize as best as I can here. I'm not an expert in benchmarking, but what I can say is that the state of Massachusetts in 2011 passed a sweeping bill that essentially allowed the state to collect cost data from both insurance companies, hospitals, physician offices, and drug manufacturers, I believe. So the Commonwealth of Massachusetts then takes that data and makes it publicly available so anybody can look at the trends of cost growth in the state of Massachusetts. But it also establishes a benchmark for annual cost growth. So I believe the number that Massachusetts set in 2013 through 2018 was 3%, right? So insurance companies would have to try their best to rein in healthcare cost spending by increasing no more than 3% in a year. If a health insurance company or a hospital exceeded that benchmark, they would be required to attend a public hearing by I believe it's called the health, I don't know the name of the committee. It's a committee established under the bill to essentially examine all of their books and come up with an improvement plan that they would be held accountable for in the following year. And all of this is public, right? It's broadcasted to the residents of Massachusetts. There's a degree of public pressure put on these companies to oblige by the benchmarks. And miraculously, throughout the 6 years this plan has been up and running, not once has the state of Massachusetts required a payer or an insurance company to submit a performance improvement plan, meaning that by and large, the payers and the insurers were playing by the rules, and they actually started reining in their costs. And Massachusetts reports that since its inception, the benchmarking plan has saved on average about $7 billion in healthcare costs in the state. And those are important lessons I think Connecticut can learn, because before we can even start attacking the cost of healthcare, we have to expose the cost of healthcare, right? We have to understand what's driving the cost of healthcare. And Vicki Veltri and her staff at OHS are doing a great job getting the governor's executive order off the ground. But I think the language offered in your bill would codify that executive order and make sure that we have a robust and permanent benchmarking and cost growth transparency system set up in the years to come, because we can always be learning by new data that comes out, and also seeing, what areas of healthcare are growing faster than others, and make sound public policy decisions that directly address those growths.
Absolutely, and it's important for you to understand the executive order, which is always some of a point of contention. But it was a way for us to manage cost and understand, to get a start. And I hope credit is given to the Republican Senate, because we, in essence, codified that. We recognize that it's a good idea, and good ideas don't need to be Republican or Democrat. It just needs to work. Because the goal, as I said in the beginning of this program, is all about containing healthcare cost and making it affordable for our residents in the state of Connecticut. So there is no bias or no partisanship. We want better solutions. So in order to say that, there are a number of things that you said that resonated with me, because it really is about transparency, accountability, and regulatory oversight. When we talked about Massachusetts as a barometer, you're looking at data as well as financial numbers that are readily available for the public to see. Sunlight shining on this data point, that there's accountability, that they have to report this data to the insurance department in the state, in the Commonwealth of Massachusetts, that there is oversight. And not once, as you said, were there any bad actors. But the fact of that may be that there was always a oversight built in for transparency. And it can't be denied, the fact that the governor's plan, 6447 and 842 does not have any regulatory mandates. It does not have any transparency accommodations. Their data, their information is very difficult to access. And one of the points that was raised by the great work of CBIA is a freedom of information request to try to get the necessary financial data, the existing of sufficiency in funds for the current partnership plans that are utilized by our teachers and certain municipalities. You have tried to get that data. It's incredibly hard to find, isn't it?
It's very hard to find, and I will admit to being fairly new in insurance policy. So I am learning a lot in the last couple of months about where to access all this information. But getting partnership cost data is one of the hardest things I've ever tried to do, and I think because it's impossible, right? To my understanding, I think that the partnership plan really right now has no mechanism or requirement to release the financial documents related to the plan solvency to the public. And that's a problem. CBIA has been relying on the insurance brokerage firm, Brown & Brown, who has a number of clients and municipalities enrolled in the partnership plan. They make their money off the partnership plan, right? They, through FOI requests every year, have extracted the information from the partnership plan, and CBIA has reported on it, right? Because it's the comptroller's own numbers. It's his data. It's the only sunlight on the program that we currently, have access to. And that's a problem, especially when there's a public option bill pending before your committee right now in 842 that would open up the partnership plan and essentially allow small businesses and nonprofits to buy into it. Well, we're talking about tens and tens and tens of thousands of new lives being, and I think, just for sound public policy purposes, it's important to understand the fiscal realities that the partnership plan currently faces before we open up further liability to the taxpayers and small businesses in this state. And I think Senate Bill 1006 does that, right? It requires the auditors in the state to financially audit either themselves or through a third-party actuary and release those findings to the legislature and the general public. That should be a no-brainer. The comptroller has always promoted transparency. It's been a cornerstone of his administration, whether it be opening up state contracts and the state payroll and the state budget. The next logical thing to do is let's open up the biggest insurance plan in the state so we can make sound public policy decisions on whether or not we want to open it up to more people.
Yeah, I find it interesting because I had to ask the question because Controller Lembo has done a good job in his public service for the state and has built an incredible reputation on the Sunlight program and the transparency on other state agencies, and I appreciate that greatly. But I find it so ironic that I can't find anything myself on the partnership data program. So that being said, it's just it's an important program. But another part that's important to me as I look at it from a layman standpoint, a man or woman on the street, so to speak, is the premise of the plan. So for the governor's plan, along with the Senate Republican plan, there is no reinventing of the wheel, meaning we're working to collaborate with current existing entities like our insurers, our brokers and service providers to be able to manage cost. The partnership program under Senate Bill 842 proposed by the Democrats and Controller Lembo has a couple of interesting nuances. And I'd love for your thoughts on that, is the sense that the Affordable Care Act, when it was enacted, provided tremendous challenges, whether you like it or not. I personally believe one of the most important aspects of that proposal was the existing condition coverage. Pre-existing condition coverage was now mandated for every insurance product sold in Connecticut and in the country. I think that was a very positive phenomenon. The problem I have is in Senate Bill A42, the public option, there's language for adverse selection to manage the financial feasibility of that program and the possibility that pre-existing conditions based upon certain parameters could be excluded by the arbiters of that program. Would that be correct? That I have to tell you, completely shocked me from a standpoint of a plan that could articulate that.
Yeah, and I think that was, I think what they call it in the healthcare world is a guarantee issue, right? So if a small employer wants to purchase health insurance coverage, they have to get health insurance coverage. They cannot be denied simply because they're a small employer or their risk profile may appear to be not advantageous to the rest of the plan's members. What the partnership plan allows the comptroller to do is not be subject to that same guarantee issue requirement in the ACA. It allows him to essentially cherry pick good risk. And the comptroller in his testimony before your committee last month said that he had no plans on cherry picking good risk. And I would say, then what's the necessity for the language? If he's able to cherry pick good risk, you also have to think about the ramifications that would have on the rest of the market, right? If you have thousands of healthy small business employees joining this pool, you're pulling the good risk from the rest of the market, and you're going to make the rest of the market, get into a downward spiral. It's called a death spiral, and raise premiums for everyone else. So cherry picking good risk is a very big concern because it helps the comptroller. It helps him get a good risk profile and establish lower rates, but it hurts the rest of the market. And it also is an uneven level playing field for the private and fully insured carriers in the state that have to oblige by the guarantee issue requirement under the ACA.
Well, Wyatt, thank you very much for the exchange. And we now have Senate Minority Leader Kevin Kelly, a longtime former chair and ranking member of the Insurance and Real Estate Committee, kind of formulating Senate Bill 1006, that I am so appreciative of your very kind words. But if I may, Senator Kelly, thank you for joining us in the world of Zoom. But could you take us through the idea of 1006? We talked a little bit with Wyatt about the reinsurance. If you can kind of further explain how you visualize it working. And obviously we contrast it with the governor's proposal. And number two, we talked about the benchmarking and that kind of savings, but also we also talked about the real need for transparency, the auditing process that we talked about. And we didn't get to the prescription drug area, which the governor raised, and it's a significant point of dialogue. But Senator Kelly, welcome, and thank you very much for joining us and your leadership on this very important topic.
Well, thank you, Senator Hwang, for putting this on tonight and to make sure that we get this message out, because this is something that when we go door to door, we hear time and again at how important healthcare is, not only to the families and to one's own healthcare, but it's also something that's important because of the family budget. And right now, and we're some 7 years after the passage of the Affordable Care Act, families will tell you that healthcare and healthcare premiums and their insurance is anything but affordable. Quite frankly, it rivals that of a car payment. I mean, people will pay more than buying, on average, a Honda Civic on an annual basis. That's what the average family in Connecticut pays for their health insurance. And that's way too much. And I think everybody agrees with this, but we've had one party in charge for the past 7 or 8 years that made this promise and has failed to deliver on it. Our bill, however, is a promise to deliver on it. If we could only get the majority or a majority of votes to support this, I think we could bring real relief to Connecticut families. And it does so on a number of areas. Number one is it does focus on the only issue that Democrats really have been focusing on, which is getting our arms around the high costs of premiums. We're going to do that with a waiver and a reinsurance program. It basically takes the current system, so nobody loses their doctor, nobody loses their insurance, everybody gets to keep their providers. And what we do is on that platform is we fulfill the promise that the federal government failed to do, and that is a reinsurance program at the state base for the legislative mandates that the legislature has put on the cost of insurance, and basically fulfill that promise and to keep premiums low through this reinsurance program. The beauty of what we do with it is, though, the governor's bill looks at a tax on that insurance carriers to fund this, where we would rather use what's known as a 1332 waiver under the Affordable Care Act and leverage federal dollars from Washington back to Connecticut to help pay for this program. That's number one. Number two is, at the end of the day, we could do all you want with insurance premiums, but unless you get your arms around the true cost driver, which is medical services itself and prescription drugs, you're never really going to solve this problem and bring the real relief the families are looking for. That's why in our bill, we do two things. We not only have a benchmarking policy, which is something that the governor rightly recognized in Executive Order number 5 before the pandemic and started this process. But where we differ in both the public option and the governor's bill is that we're going to embed this in state law, so that whether we have this governor or a new governor, this law will stay in place. And it's something that Republican Governor Charlie Baker in Massachusetts has used for the past 6 years or so, that has saved his state over $5 billion. That's real money. And if we take those savings and put them back in, repurpose them back into healthcare and reduction of premium, this bill could pay for itself. And that's a big difference than what the Democrats are offering. The third is to look at prescription drug costs. Now, we're proposing something that we obviously will need, I'm going to say federal help with, which is to import prescription drugs from Canada. But something that started when I was chairman of insurance in 2018 was we passed groundbreaking legislation that would allow more transparency into drug pricing. And armed with that information, and it's just starting to take root now, maybe in the next couple of years, we can start to focus and drill down on the actual highest cost driver in medical care, which is the prescription drug area. And then we also look at other issues which deal with, one, health equity. We were brought forth a bill a couple years ago now, looking at a task force on health equity, because even before last summer, we recognized that there are disparities in the delivery and outcomes of our healthcare system, and that's something that everyone should be able to count on and make sure that it delivers for them. And when you see this disparity, that is something that needs to be addressed because it's not fair. And then last, what you talked about, Senator Hwang, is the accountability. I mean, we know in the partnership plan that the partnership plan over the past couple of years has run in the red. There's been $30 or $40 million already that the taxpayers have backstopped the comptroller's attempt at a narrower public option, and it's projected this year alone to be looking at almost $100 million in the red, and that just once again we're picked. The Democrats' plan picks winners and losers. Those that got into the partnership plan, as Wyatt was indicating, they're lucky. If you didn't, or you aren't going to be selected to be part of these chosen few, you're going to end up paying more because your risk pool may be not as favorable as those picked by the comptroller. And the more people that they do put on Medicaid, obviously, is another area where you have a cost driver on private insurance. And last but not least, let's not take our eye off this ball. What we like to do is to focus and work with people who, I'm going to say, have been good to Connecticut. And one of the industries and one of the biggest job creators in our state is the insurance industry. We like to believe that we're the insurance capital of the world. We've had a long and storied tradition with this industry. And these are good paying jobs. These are not the minimum wage jobs that the Democrats are good at developing. These are good, solid jobs that can buy a house, pay a mortgage, educate kids, and make our communities a better place to live. And what we do is we try to maintain those. There is a reason why Connecticut is dead last in the nation in not only job growth, but also personal income growth. It's because Democrats have pushed forward policies like the public option, where they tell the people of Connecticut, we're going to promise you one thing. They're short on delivering that thing. But in the meantime, the consequence is job loss. And what we believe we can do is not only keep those good paying jobs, we can deliver on the promise of affordable health care and make sure that our system remains strong with a good, healthy health care. And like you talk about, you look at companies like Pfizer that have been able to develop the vaccine. Keep that good Yankee ingenuity right here in Connecticut and make sure it continues to work for our people.
Thank you, Mr. Senator Kelly. And you raise a very important point that, I said earlier in the beginning of the program that Democrats and Republicans all believe in looking to make healthcare affordable and contain costs. We vary on how the approach is. The Democrats right now are looking at a state takeover plan. We're trying to create a better way that collaborates and incorporates all the shareholders like CBIA, our insurance companies, our brokers, and people that are being impacted by this. And I'm really, I want to applaud your collaboration and your openness in working and persuading the governor and the administration to see some of the proposals that we've taken and decided to propose them in 6447. So I really wanted to share with the general public that us as Republicans in our proposal in 1006 are looking at solutions, and whoever is willing to come along with us. And we see right now that the governor has taken on a lot of these initiatives. What would you say to that from the standpoint, we care about solutions, not who gets credit?
Right. Well, I mean, just the whole concept, the reinsurance idea, that started when there was a movement for the public option. And I sat down, looked at reinsurance and the exchange, which is what Connecticut has, Access Health, where you can find all your, Obamacare coverage is at that exchange. And what they did was they commissioned a study in 2020, and actually 2019 and 2020, to evaluate the effectiveness of the reinsurance plan that we were proposing. And they came back and said, yes, as a matter of fact, it works well. And if you want to get the best leverage of not only federal money, but also to get to the lowest cost, our idea of the reinsurance with a general fund appropriation rather than a tax on premium was the best way to go. We also tore a page out of someplace like Massachusetts, where Republican Governor Charlie Baker has been successful in lowering costs, and brought that to Connecticut. And that is something that the governor did recognize, and he signed the executive order to start that process here in Connecticut. He did that in December of 2019. But we now need the enabling legislation to put that in place and to embed that in law, not only so it continues beyond his term, but also to enable the state government to get the requisite information. And we do that. We look at this and we believe this is a strong policy. And the governor's office has also recognized, as Access Health did, the benefits of the reinsurance. We differ, however, on how to go about funding it. They believe that if you're going to utilize an insurance product, there should be a tax of some sort on it, where we believe that we would rather than put that full tax 100% on Connecticut residents. We'd like to leverage some money out of Washington and also get the best or achieve the lowest possible cost. I mean, that's what's breaking Connecticut families back is when you're paying $1,000 a month on insurance. That's a crusher. That kills any kitchen table economics, and we need to bring relief to the middle class family, and that's what we're looking at, and that's what we're focused on.
Right. Wyatt, I just wanted to respect your time. I know you're on the waiting list for testifying. If you want to go ahead and get into the public hearing, I just wanted to give you that opportunity and extend my gratitude to you and CBIA for your insights with us. So you're welcome to stay on and engage. But if you feel like you have to go to the public hearing, this is your opportunity.
Well, thank you. And let me just say, Senator Kelly and Senator Hwang, the CBI membership really appreciates the path you've laid forward in this bill. Not relying on assessments, not relying on a broken partnership plan, but really getting at the root cause of healthcare and getting creative with the way we leverage federal dollars. So if I can be of help to either of you in the future, please reach out. But I guess I'll see you in a couple minutes, Senator Hwang.
Yes, thank you, Wyatt. And Senator Kelly, if you don't mind, while we're on still, it's interesting. One of the things I shared that was a note of kind of surprise for me in the public testimony with Controller Limbo on Senate Bill 842, the public option bill, was the fact of the ability for that plan and the controller to adversely select members into the plan, to in his words, cherry pick some of the pool and risk management. And honestly, for me, one of the good things that came out of the Affordable Care Act was the coverage of pre-existing conditions for everyone in this state and in this country. I cannot tell you what a relief that has been as a program. It obviously has made an impact on cost, but what I got out of the conversation and read in the bill of the public option, Senate Bill 842, is the fact that pre-existing conditions can be a exclusionary factor, that you could be denied coverage under the partnership program. That was a shock to me, and I think the other premise that was shared earlier was the fact that the premise of getting the same doctor, you emphasized that in your first statement, the emphasis of being able to keep your doctor, keep your current providers and healthcare programs. That was the promise under the Affordable Care Act, and it was not realized. Our actions and efforts in providing a better way through your leadership is to say, don't overpromise, deliver what you are looking to provide.
Absolutely. And the promises were affordability, access, and quality. And one of the big things here, and why I think it's so shocking, is that the Connecticut Democrats here with the public option have departed from what they talk about on the campaign trail. You'll hear them talk all about how they want to maintain pre-existing conditions in that coverage. But then when you look at the bill that they're proposing, it allows discrimination. It allows adverse selection. It requires or allows the comptroller's office to look at the cost by county, so that somebody, if the high cost is in Greenwich, the person that's in Bridgeport is going to pay a higher cost because of the expenses in Greenwich. And these are all the things that they complain about the insurance industry, but it's in their bill. And the reason they can put it in their bill is that their bill is really a government-run healthcare payment program. It's not insurance, so it doesn't have the protections of the Affordable Care Act, and it's not regulated by the Connecticut Insurance Department. Because it's not regulated means that the taxpayer, if the comptroller makes a mistake in his actuarial calculations as to is he charging enough for the fees of his payment program, what happens is the taxpayer left on the hook. And as we know, in the past 2 years, there's been a $40 million loss in the partnership plan. and projected going forward almost 100 million. So those are some big numbers that the taxpayer is going to be on the hook for. And it's something that, when you look at it, this is not what insurance companies have the opportunity to do. But once again, Senator, like you said, if we stay focused on what families are asking for, the solution to high cost medical care, our bill does it. We not only reduce premiums, we get at the cost drivers, and we keep good paying Connecticut jobs. It's just common sense, and it's pro family, and it's pro Connecticut.
And it's pro middle class, Senator Kelly. It's interesting. The Office of Healthcare Advocates just testified this afternoon that in their experience in recent years, the households that struggle the most with healthcare insurance affordability issues are the family that has 130,000 with 4 individuals that are falling between 250% and 400% of the federal poverty level. They're the population, the middle class in the state of Connecticut that are struggling the most with affordable care, healthcare costs. And none of the current proposal under Senate Bill 842 really addresses that. And we're trying to provide solution to enhance and to protect the middle class in the state of Connecticut. Your thoughts on that?
Well, I mean, when they go after the middle class, what they want to do is use the Medicaid platform, which once again is a government-run healthcare payment program, and utilize that platform as the place where they would like individuals in this range to obtain some sort of benefit. The problem with that is really twofold. Number one, and armed with the Mathematica report that the governor commissioned after the results of COVID in nursing homes, that report found that the Medicaid reimbursement rate, which is a discount, was largely to blame for the poor health outcomes in nursing homes. Remember, I said before that the Affordable Care Act made a promise of affordability, quality, and accessibility. Well, quality isn't poor health outcomes. Quality means that you want the best. And if you're offering Medicaid as the best, that's being a disservice. It might be affordable, but it's not the best. And that's why I think what we look at is making sure that we keep the current healthcare industry. Look at ways to save money, like it's been successfully done in Massachusetts. But make sure that people have the best and the brightest. They have the best healthcare, that it's accessible and affordable, and we do all of those things.
Thank you, Senator Kelly. And I'm not sure with our support staff if there are any questions from the audience members to ask of us. So one of the questions, Senator Kelly, is does the GOP plan do anything to address the lack of providers that are currently accepting Husky? It seems like an uphill battle to find doctors willing to provide care under the Husky program. Again, going back to what you said about the promise of the ACA, and I do believe, and if you could articulate a little bit more, sometimes the support of the premise of that by sometimes our doctors and hospital providers, because they don't always understand that it is an end-sum game that may not always end well for the patient and the consumer.
Yeah, what you have when you deal with Husky, and this is why when what the Democrats are proposing doesn't fulfill the promises of the Affordable Care Act, once again, affordability, quality, and access, is that when you start to operate on this Medicaid platform, which is Husky does operate on that Medicaid platform, Medicaid reimburses the providers at a discounted rate. So if the provider's making a dollar of care, is providing a dollar of care, Medicaid is only going to pay him, let's say 70%, maybe 70 cents on the dollar, which means that they're going to cut corners, or you don't get the access, you don't have, all the providers don't take it. And so it doesn't fulfill the promises of the Affordable Care Act. on the other hand, what it also does is because that is at a lower cost, it puts upward pressure on people's private health insurance. This is one of the reasons why health premiums continue to go up if you're in the private fully insured market, is because you put a person on Medicaid, they're paying 70 cents for the dollar of care. That means that the person that has a fully insured is going to pay $1.25, maybe $1.30 to offset that cost of care. So you have upward pressure on people with private insurance. But more importantly, and what the question is asking for, and this is where I think there's a big failure in the Democratic bills, is that by putting more people on a Medicaid or a government payment plan, it reduces access because many providers just don't want to take the low reimbursement rate, and you get what you pay for. And Democrats are happy giving you lower quality, less access, as long as the premium is what they look at. And our plan looks at everything. It looks at lowering the cost, maintaining the quality, improving access, and keeping jobs.
And along that same vein, in looking at everything, the question another question that's posed is, how would the Senate Republican plan address health equity? Now, I'm glad to have that question be asked, because you've been a leader in addressing that in your role as chairman of insurance, and also right now in your proposals. Tell us about your thoughts on health equity and how important that is.
Well, obviously, the statistics demonstrate that even if individuals have the same socioeconomic status, have the same insurance, go to the same providers, many times you have different health outcomes. And that needs to be addressed, and we need to look at that in much more granular detail. Now, going back to 2019, we had a bill that would do this. And starting of that 2020 session, we introduced the bill to study this issue. And quite frankly, I was surprised that when we had special sessions both in July and September of last year, that we didn't move this bill forward. Move the bill forward to jumpstart and start to drill down on this and get the information, so that the hope was, with the task force bill we proposed, was that we would work on it through the summer and fall to propose legislation this year. The fact that the Democrats, who have the votes, have been dragging their feet on this is surprising, because I think it's something that needs to be looked at. We are going to be no worse for the wear. As a matter of fact, as a society and a community, we'll be better for it. And I think the sooner we start looking at this in its granular detail, the better we will be.
Thank you. And you have been a true champion. You've educated me a lot on the importance of health equity. Now, one of the other questions is, when you talk about the number of votes, what are the chances of the Senate Republican plan passing? Is there anybody else on board beyond the Senate Republicans? I'll caveat, and I'll defer to you as well, by saying good ideas don't have a party. Good ideas aren't on a basis of vote counting. And the fact that our proposal has been welcomed and adopted by the governor, a Democrat, in his executive order via benchmarking, the reinsurance, the utilization of that as a product, prescription drugs, and their receptiveness to transparency. The reality is the GOP plan is a better plan, and it's one that should be strongly considered. And I do believe it has a great chance of passing, because it is a much better plan. Your thoughts on that?
Well, first, I agree on the good ideas, but the one thing you left out is that good ideas attract friends, and I think that's why it resonates. It's based in solutions. It's a good idea. It's based in solutions. I mean, the Access Health, they vetted this through the Wakely report, and it came back and said, yes, exactly, our plan works. It not only works, but it's the most effective at reducing premium costs. So that is Charlie Baker in Massachusetts has been successful with benchmarking. We put a little bit of a twist on it, in that we want to make sure that as we do achieve savings, we don't do it at the expense of individuals who are dependent upon the healthcare system. So we want to make sure that we don't leave people behind as we move forward, because that's a lesson you can learn from Massachusetts. But so we're looking at the real solution as to what's the real problem that faces middle class families. And this is where I think it's starting to get some traction. Where we fundamentally still differ is that we believe this should come out of the general fund appropriation as opposed to a tax on the insurance industry itself. And that's a fundamental disagreement between us and the executive. And then just totally with, the comptroller's plan, which is just a government-run program versus everybody keeping private insurance and keeping insurance jobs. That's a whole fundamental divide there.
Well, in light of the current Superior Court decision regarding the expanse and perhaps limitations of the governor's executive order powers and the struggles that we have as a legislative body to have our voice be heard and engage in this whole process during this COVID pandemic of Zoom meetings, as we're doing right now, there's a question of transparency and validation and real exchange of ideas amongst all the shareholders. What do you say to the idea that Senate Bill 842, the controllers and the Democrats' public option bill, and the public hearing held today for the governor's proposal of 6447, and the fact that the Senate Republican bill of Senate Bill 1006, I know there's a lot of numbers, will not be heard till Thursday at noon. And there is that possibility, Senator Kelly, that the public option, Senate Bill 842, the controller Democratic bill that had a hearing in early February, may be put forth in a committee meeting of the Insurance and Real Estate Committee at 9 o'clock on Thursday to be voted and joint favorably approved or not out of the committee. Is that transparency? Is that due process?
Well, first, it's just as far as the public hearings, what I would say, they've had the first two, they saved the best for last.
Yes.
And so here we have an opportunity to shine. I would hope that the majority wouldn't go forward without hearing the entire story. But once again, this is why Connecticut's dead last in job growth and dead last in personal income growth, because the majority at times becomes tone deaf to the actual, I'm going to say, events that middle class Connecticut experiences. It's almost as if they don't walk in the middle class shoes. Let's stay focused on the issues. Rather than looking at national narratives and getting into partisan conversations. I mean, that court case that you referenced, I mean, every time we say exactly what that judge said, is that the people are a separate but equal branch of government. The people, it's their government. The government of the people, for the people, by the people was created in Hartford. We're the Constitution state. And the people need to have a say in what happens. We're not wired for one person rule. That's what the judge said. Now, when we bring that forward, it's not uncommon for the majority to say, oh, we're radical, we're dangerous. And you don't hear them saying that the judge is dangerous, because you know what? The judge made sense. The judge was reasoned. He was practical. And he stayed focused on the issue, just like we do. And I think if we stay focused on the issue, we can deliver for middle class Connecticut. And that's what we've done here, is we've come up with a plan that can reduce healthcare premiums. We can get our arms around the driving cost drivers of healthcare and maintain good paying jobs and access. It makes sense on so many levels. And I think when we have that public hearing, whether they take the vote on the other bill or not, when we put these on the floor of the House and the Senate, we'll have a real conversation. And
well,
I think a real choice.
I think the phrase you said to me, and it made so much common sense. Good ideas attracts friends. Mm-hmm. And the support of CBIA in complementing and articulating the ideas that was offered by Mr. Bosworth was a real big compliment to you and the people who put the proposal together. And we are up to our hour. I appreciate your thoughts, Senator Kelly. And any closing thoughts, closing words of wisdom?
Just thank you very much, Senator, for putting this on and for your advocacy and service to our state and on the insurance committee, and for the good work you do, not only for Connecticut, but your district, and keep up the good work, and let's keep moving forward.
Thank you, Senate Leader, Minority Leader, Senator Kelly. But I have to admit, kudos goes to you. You have been a long-term advocate in raising this issue, awareness, and providing better solutions. So I'm glad to follow your footsteps in the Senate ranking role in the Insurance and Real Estate Committee. It is a policy that's going to have profound impact on people's lives, and we should proceed with a better idea that's sustainable and viable. So thank you very, very much. I want to thank CBIA, Mr. Wyatt Bosworth, for joining us and offering his perspective from the nearly thousands of businesses, small, medium, and large, and the hundreds of thousands of Connecticut employers and employees that spoke their mind on this issue. So thank you very much, Senator Kelly. And for those that are listening, thank you very, very much. Have a great day. Stay safe.
Take care.
Bye.